Welcome back. Good to have you with us here on eNCA. I'm Gareth Edwards as we head up to 7:30. Gauteng, very much the epicentre of COVID-19 infections. You'll remember the province is already on the grips of this third wave and the numbers are getting worse. And now SANDF reinforcements have been brought in to help the healthcare professionals. At the same time, the province Premier, David Mukura, says that a stricter lockdown could be announced soon. Let's unpack that. I'm joined by Gauteng Premier's Advisory Committee on COVID-19. It's the member of that. It's Professor Bruce Mellado. Professor Mellado, it's always a pleasure speaking to you. Level 5 lockdown. Gauteng is going there surely. When is it going to happen? The numbers are too high, isn't it?
Thanks for having me, Gareth. So let me give you a quick rundown on where we are. So as has been discussed by you and others on eNCA, the numbers keep growing. The numbers sit on a trajectory, we call it a trajectory of the worst case scenario, where we should be peaking around the first week of July, barring, of course, unexpected spikes like the one we had 2 weeks ago. So if no new spikes appear or emerge, we should be looking at continuous growth for about 2 weeks more, which basically means there will be continued stress on the system, especially the healthcare system, and indeed some measures are actually being discussed, which will be later announced by the Premier later in the week. Now, we also have to take into account that this wave is fueled more than ever, more than the other two, by mobility and non-compliance to social distancing measures while we move. Mobility, as we know from reports from different sources, stand at the highest point since the advent of the pandemic. And we also are aware through different sources and different studies and analytics that the level of adherence also is lower than the second wave. So clearly what we have to do and what we have advised the Premier to do is to focus on areas and measures that are effective, that are known to be effective in order to curb non-compliance.
Professor, help me understand, because what I'm hearing, and I'm by no means a medical expert, I'm merely a journalist. So these are the highest numbers in the province that we've seen since the pandemic reached South Africa. We are expecting the peak of this spike, essentially, by the first week of July, which would give us another 7-8 days away. Why does it sound like we're waiting for the worst to happen, knowing it's coming, instead of just shutting down the province now and mitigating that for later? If we all know it's coming, why aren't we locking it down today?
Right. So you have to take into account, and we all have to take into account as citizens, and I'm a citizen as well, that this is a very complicated balancing act. I mean, shutting down a province, basically that means shutting down livelihoods and people's ability to earn a living. So what we have to be focusing on is on effective activities and effective measures that we know from past experience, including harder lockdowns, that work and are effective. And these will be announced later in the week by the Premier in consultation, of course, with other stakeholders. Now, we also have to take into account that level 3 was reinstated essentially a week ago. So it is now that we should start feeling the slowdown of the numbers due to the level 3 restrictions being reinstated about a week ago. So the reality is that this is about managing a problem, is managing a pandemic, which is a multi-pronged approach of the stuff that we have to do that is effective, which include, of course, as we have seen from doctors and reports from all over the province, include adding capacity to the healthcare system, and a number of measures will also be put in place in extremis, as the Premier will be announcing later.
Professor, let's talk a little bit, if we could, before I say goodbye to you in the last minute or two I have with you, Prof. Let's talk about the military health personnel coming into Gauteng this week. Give me a sense of the kind of impact that they've had. How have you allocated those SANDF resources, and are we starting to see that being helpful in hospitals?
As a committee, we welcome the help that the SANDF is providing to the province. That is very valuable. That has been, as has been discussed by other stakeholders. The impact and the allocation, of course, that has to be discussed by the Department of Health. We don't have the data to ascertain what the impact is, and this will be also reported in due course by the Department of Health.
If I could just ask this, Professor, I've just spoken to Dr. Donnie Ficknow. He works for the Netcare Mill Park Hospital, and I asked him this question. And maybe if you can't provide the answer, maybe you could help Gauteng and South Africa and take this question to the Premier next time you meet him. Unemployed doctors in South Africa, in the province, willing to help. Some of them are interns, some of them are qualified doctors. They can literally help push beds, hang up drips, and move furniture around to create space. Could we not speak to the Premier, please, and try and see how we can get these doctors in? 288 doctors sitting, waiting, ready to be used. We have them. Can you talk to the Premier?
You're raising a very good question. We do raise these questions on a regular basis. What measures could be put in place in order to add capacity? That is of the essence now. Even though we're going to be reaching a peak, the numbers will keep growing, and therefore the pressure will keep mounting. So this is one of the prongs of our advice, is to find ways, including what you just mentioned, to enhance the capacity of the province. And as I said, there will be a press conference later in the week that will detail some of these measures. And of course, the Premier is very much aware of the pressure that the healthcare system is undergoing, both in the private and the public sectors. And you're completely correct. Now is the time to think out of the box, to basically, I wouldn't say get rid, but to overcome some of these bureaucratic burdens that are, so to say, slowing down the release in this capacity. And we're not talking about also doctors, we're talking about facilities, and I know very well, you know very well what I'm talking about, to basically release some of these bureaucratic burdens that are getting in the way to create the extra capacity we need to deal with the peak.
Professor, it's always such a pleasure speaking to you, Professor Mellado, and I know that you'll take that message to the Premier. You've got waiting doctors, waiting interns ready to help. Never mind, as you say, the facilities that are not being used at the moment. We'll get onto that conversation another day. Professor Bruce Mellado, thank you for your time. Wits University and Gauteng Premier's Advisory Committee on COVID-19 at the moment. So the unemployed doctors in South Africa, we heard you, we asked the question, and hopefully the Premier will respond. Let's take a look.